Hey guys, welcome, and we're so glad to have you join us for today's mini review. As you're joining us, hop in that chat, let us know where you're joining us from, or give a shout out to your school. Okay, so either way, let us know where you're joining us from, or give a shout out to your school there in that chat box. All right guys, as you're doing that, my name is Ashley. Everybody calls me AG. I am the Social Marketing Director and a faculty expert here at Hurst Review. I'm a nurse. I've been a nurse for 16 years, and I've been with Hurst Review for 11 years. And I love what we do because we make sure that our students are ready to go to pass the NCLEX on their very first attempt. Now, if you've already taken the NCLEX before and you've been unsuccessful, don't panic. This is what we do. We love helping all test takers take and pass the NCLEX. All right, let's go ahead, jump in, get started. And the very first thing that we're going to talk about is let's just cover what the NCLEX looks like. So when you take the NCLEX, you're going to have 5 hours to take it. Now, it might not take you 5 hours, but you've got 5 hours testing time just in case you do need it. You're going to see a minimum of 85 questions and then a maximum of 150 questions. So not everybody will take the max test. Your test can cut off at any point in between these two numbers, but everyone will see at least 85 questions as their minimum. All right, let's talk a little bit about Hurst Review because I want you guys to understand who we are and what we do as a company. We are a company of nurses for nurses, and what we make sure of is that you are ready to take your NCLEX. And we're teaching you from the best standpoint because we are nurses. So our founder is a nurse, our entire curriculum team, all nurses. All of our faculty are nurses, but we've also got one or more nurses in other places just to make sure that we're giving you nursing support in everything that we do. So you're going to see that we have nurses on our sales team, marketing, social media, and customer support. Again, just to give you that nursing support. All right, let's talk a little bit about data. Okay, now what we want to do here is we really just want you guys to understand how our pass rate works. We want you to understand our recommendation rate too. And so when it comes to our data, 9 out of every 10 students recommends the Hurst Review to a friend. And now guys, this is very important because we know that word of mouth recommendation is the best one that you can get. And so we love when we see people tag Hurst Review on social or maybe in a forum, or even putting those testimonials on our social media or on our website as well. We love that. Now, we had a 98% first-time test taker pass rate, but we have recalculated our pass rate to make it more current, just to look at the last few years. And guess what? It went up. It is 99.8. So our first-time test taker pass rate for students who utilize the Hurst Review, follow our checklist and our plan for success, is 99.8%. And we love the fact that we're not only helping students in this way, but that pass rate is showing that. And we've been doing this for 30 years and more. So guys, I love the fact that yes, we've been around for a long time, but our pass rate has been this for a long time. We love the fact that we have such a high pass rate, and we've been able to hold it for a very long time. All right, let's talk about the NCLEX just a little bit more. There's some information, and this information is not from us. This information is from the NCSBN that we feel like would be very helpful to you taking your test. Okay, first, if you don't pass your NCLEX on your very first attempt, then your chances of passing have automatically declined. Now, why is that? It's not because they make the test harder or anything like that. This is mainly because of the fact that you've been out of school for so long. The NCLEX is very clear about the fact that if you want to have the best chance of passing possible, you should take your NCLEX within 3 months of graduation. That is going to give you the highest chance. Well, you already know if you don't pass, you have to wait, right? You have that waiting period, 45 days. Well, every time that you have to take it, you have to wait those 45 days. That's going to put you closer and closer, or maybe even beyond that recommendation that the NCLEX has about the 3 months. Another thing that happens is that people don't look at this test as the safety test that it is. This test is not another nursing school exam. This test is a safety test in its entirety, and people don't look at it like that. Okay, so if we're looking at it the way that it is designed, we're trying to show the NCLEX people that we know how to keep people safe. And the NCLEX is trying to protect people from unsafe nurses. I don't want to be one of those. I want to be a safe nurse. And so we want to show the NCLEX people that we can do that. And because this test is different, the focus is different, don't expect it to look like a nursing school exam. Don't expect any of the questions to be anything that you had on a nursing school exam. It's going to be different. And the way that you answer these questions is going to have to be different too. We're going to talk about that as well. All right, now our workbook is your study guide. And guys, I love the workbook because it is short, concise, to the point. It has pictures, diagrams, charts, and graphs. It also has blanks that we help you fill in. And so as you're filling in these blanks, you're going to have a very clear picture of what you need to look at and study for the NCLEX. Students report all the time that they're able to use our workbook as their study guide. All right, what we want to do today is give you a snippet of how we actually teach. So we're going to use the topic of complications of diabetes to do that. Now guys, what you're going to see is all kinds of stuff popping up on your screen. Feel free to take all the notes that you want. You can ask all the questions that you want too. That's what I'm here for. And so you can hop in your chat at any point, ask away, ask those questions. And then at the end, we're going to do some questions together as well to work on our knowledge and to work on testing strategy. All right. Let's get started, and the first thing that we want to cover is let's just talk about some signs and symptoms of hypoglycemia. Okay, but I want you to understand what are the complications we're going to cover. So these are going to be the complications of diabetes that we're going to cover in this section. And guys, there's quite a few of them. And so in this whole section, this is what we're going to go over. Okay, but the first thing that I want to do is let's just make sure that we understand the signs and symptoms of hypoglycemia. So I want you to hop in your chat and I want you to tell me any sign and symptom of hypoglycemia that you can think of. Okay, any sign and symptom of hypoglycemia that you can think of. Let me know in the chat. All right, these are textbook signs and symptoms, right? Yeah, they're the things that we talked about 50 million times in nursing school. So you can write some of these down if you want to, okay, but you don't have to write all of these down because you know most of these. And again, most of these are going to be in your textbook. You've got things like cold and clammy, right? Yeah, that's the first thing that I think of. Okay, so cold and clammy. Confusion. The client may be shaky or jittery. They might have a headache. They could be nervous, have nausea, increased pulse, and then this is the most classic sign and symptom, and it's the one that people don't think of, hunger. If you're hungry, your body is giving you a very early signal that you're getting hypoglycemic. So hunger is a very classic symptom too. All right, so let's think about this. I got a question for you. If you're hypoglycemic, what should you do? There's a very simple fix for this. Okay, if you're hypoglycemic, what should you do? Okay, well, the answer is that you need to eat or drink a simple carb. Okay, eat or drink a simple carb. And what this means is about 15 grams of carbs. Now, an example of 15 grams of carbs is something like 4 to 6 ounces of Coke or juice. Now, no, not 46. Don't go to the gas station and get like the biggest cup that you can find. 4 to 6. Or maybe 8 to 10 lifesavers. Now, I know that sounds wild because I never ate that many, but it's 15 grams. Okay, and that's going to be about 8 to 10. Now, yes, you can use food too. That will help to get the glucose up. But just make sure that you don't pick a food that has a lot of fat. Because if you choose a food with a lot of fat, it's going to delay the glucose absorption. Then, after you have that 15 grams of carbs, you're going to wait 15 minutes, check the glucose again, and if it's still low, you need to repeat with another 15 grams of carbs. Okay, so what do we call this? This is the 15 by 15 by 15 rule. Okay, so just a quick recap of what this is again. You're going to eat or drink 15 grams of carbs, wait 15 minutes, and then take your blood sugar again. If the blood sugar is still low, then you need to repeat this 15 and take another 15 grams of carbs. All right, now after they do this 15 grams of carbs and they get their glucose up, what should they do now? Because see, we have to go beyond this, right? Okay, once their glucose is up, what should they do now? They better eat again, right? Okay, but this time they're going to eat a complex carb with a protein. Okay, a complex carb and a protein. And guys, the most classic example of that is peanut butter and crackers. Okay, and I know you know that one from nursing school. That's a good example for sure. Now let's think about it. If they just drank the Coke or the juice and then didn't eat the peanut butter and the crackers, what's going to happen? They're going to bottom out to hypoglycemia all over again. And guys, it's extremes like that bottoming out. It's not just high glucose, it's low glucose too, that equals vascular damage. The more they have those fluctuations in glucose, the more vascular damage they're going to have. And we don't want that. All right, let's pretend. You're going to enter a known diabetic's room and they're unconscious. Are you going to treat them like they're hypo or hyperglycemic? Okay, let me know in the chat or the comments. And you walk into a room, your client, they're known diabetic, and they're unconscious. Do you treat them like they're hypo or hyper? Well, this is what you have to think about. You have to think about it could be either one, but which one is more dangerous acutely? Hypoglycemia. So I'm just going to pretend like they're hypoglycemic. I'm going to run to the drug cart, get the Ampula D50. I'm going to come back. I'm going to push it IV, and I'm going to hope that they wake up. And when they wake up, they need to eat, because if they don't, this is going to happen all over again. All right, now I really love D50. That's my favorite because that's the one that's IV. It's going to go to work the fastest. But I also really like injectable glucagon. That's the one that I can give when I don't have IV access, or I could still give it IV if I needed to, because that one you can give multiple routes, IV, IM, sub-Q. Okay, but remember, I like D50 the favorite or the best because that's the one that's going to work the fastest. All right, let's talk about what we do for prevention, because we really want to try to prevent hypoglycemic episodes when we can. So the first thing I'm going to do is I'm going to tell my client to eat. Okay, that is number one. And then I'm going to tell them to take their insulin regularly. If they're an insulin taker, they need to make sure that they take that insulin regularly. They also need to know the signs of diabetes. Like, I need to know, the signs of hypoglycemia. I need to know when my glucose is getting too low. That way I can do something about it. And then the last thing is they need to check their glucose regularly. They need to know what their glucose is looking like. So these are all the things that they can do just to make sure that they are preventing. All right, guys, this is a perfect place for us to do a clinical judgment exercise. We've got a question for you, and what I want you to do is look at this question. I am going to read it to you just in case it's a little hard to see. So you got your pawpaw. Now, guys, that's just the way that us Southerners say grandfather. But if you have another name for your grandfather, please put it in place of this. Okay, so you got your pawpaw. He's at home. He's a known diabetic, and so he goes and he checks his glucose. And it is low. It is 60. So he's all weak and having a headache, so he didn't feel good. He knows that he needs to get that glucose up. So he's going to go to the kitchen and get something to eat. I want to know, out of these options, what choice or choices would be the best for pawpaw? Now, just a reminder, this is a select all that apply question. And with select all that apply, there are no limitations to the number that can be right. So look over these and then let me know in the chat what you think the answer is. All right, guys, if you need more time, you've got it. But what I want to do first is let's just cover the rules of select all that apply. Okay, I already told you one big one. There are no limitations to the number that can be right. You are free to pick one, all of them, any number in between. Now, this select all that apply question is not in a case study. If your select all that apply question was in a case study format, There could be up to 10 options to choose from. But guys, don't panic. It doesn't matter if there are 5, 6, or 10. You're going to treat this the same. Each one is a standalone true versus false option. That just means as I look at option number 1, I ask myself, hey, is this true? If it is, I pick it. If it's false, I leave it off. When I move on to number 2, I do the exact same thing, except I don't think about number 1 anymore. And I don't look ahead to number 3. I'm only going to look at the option presented to me one at a time and ask yourself, is it true? No limitations. Any number can be right. And now the other thing is maybe you want to go back and reread your stem of the question with every option that you select because maybe you misread, and that will help you. Hey, here's another really good strategy. Please know that yes, you do get partial credit, but don't rely on the partial credit because it doesn't mean what you think. What you think it means is that, oh, I just got to get some part of the question right. No, it could vary. It could be like lots of factors that they use to give you partial scoring. So depending on lots of factors, you may get one part of this question right, but still get no credit for it because maybe you got too many other answers wrong or you didn't pick enough right answers. So you have to make sure that you're trying to treat this like, I'm going to get the full question right. That is a really good strategy. Okay, just try to get the whole thing right. All right, let's look at this one together and figure out what's going on because there is no way that I'm going to be able to pick the right answers if I don't even know what the problem is. So here in this scenario, I've got a client who is a known diabetic and they start getting hypoglycemic. And they gave me multiple clues that that was true. First of all, they gave me a glucose. And then they gave me the normal ranges, which they will do. If it's a lab value, they will give you the normal ranges for that. So if the value, if they just say low or high, they will not give you the ranges for that. But see, they said 60. They very specifically said a number. And when they did that, they told me what the normal range is. So 60 is too low. And then the client also has signs and symptoms of hypoglycemia, a headache and feeling weak. All right, well, what I know is that when somebody is hypoglycemic, I'm trying to get their glucose up fast. If somebody was hyperglycemic, I never want to bring down their glucose too fast. I want to do that slowly. But this is hypo. I'm trying to get their glucose up quickly. So what I'm going to do is I'm going to pick options that would get the glucose up quickly, but there's nothing to delay the absorption. Because remember, there's sometimes things that would delay that absorption of that glucose. All right, so let's find those options. Look at number 1. A lot of times people don't pick option number 1 because they're like, oh, it's milk. Okay, well, what you have to know about milk is that milk is a carb. It doesn't have to be sugary sweet or taste sweet in order to get the glucose up quickly. Guys, milk is a carb and all carbs get your glucose up quickly. Now, let me tell you something though. If this would have just said milk, plain, I would not have picked it because milk has fat. And fat delays the absorption. But they were very specific about what type of milk this is. This is fat-free milk. How do I know that? It says skim. Skim milk means that they have removed the fat. So this is no-fat milk. All it is a carb. That is going to get the glucose up quickly, and there's nothing to delay the absorption. Option number 1 is true. All right, let's look at option number 2. All apple juice is a simple carb. This one is true. This is just juice from an apple. Option number 2 is true. All right, now I know some of you liked that milk chocolate bar option, but milk chocolate bar has fat. So yeah, it's sugary sweet and it's going to taste really good while they eat it, but their glucose is not going to go up quickly because the fat in that milk chocolate bar has delayed the absorption. Remember, I'm trying to get it to go up really fast. All right, that 4th option there, that sounds really tasty too. But 3 oatmeal cookies, guys, cookies have fat. And that fat is going to delay the absorption. I'm trying to get this glucose up fast. Option 4, false. And then what is a handful of raisins? It's just a simple carb. Okay, it is sugary sweet and is going to get the glucose up quickly. It has no fat in it to delay the absorption. So I picked simple carbs with no fat to answer this. Option 1, 2, and 5 are my correct answers here. All right, guys, let's take this scenario just a little bit further. Let's say that Pawpaw didn't quite make it to the kitchen on time to get that snack, and he just lays out on the floor and he starts having a hypoglycemic episode. Now, Mama, Southern for grandmother, whatever you want to call your grandmother is fine there. Mama walks in and she sees Pawpaw all cold and clammy on the floor, having a hypoglycemic episode. Now, she knows that she's supposed to keep those little tubes of cake decorating gel so she can squeeze a little bit underneath his tongue. He would absorb it and then wake up, and then he'll be fine. He can eat and be fine. But she doesn't have that. So let's think of some other things that she might have available in her kitchen or in her pantry that she can use instead. I'm going to give you a really big hint here. Think similar consistency to cake decorating gel. The first thing that pops in my mind is honey, right? Yeah, honey works really well here. Syrup works really well here. Molasses, jelly, anything like that, that thick, sticky, syrupy consistency is what I'm looking for. And just a little bit now, okay, not a lot, because you don't want Pawpaw, aspirating Welch's grape jelly. That, grape jelly in the lungs, not good. Okay, so we want to make sure that it's just a little bit. And when Pawpaw wakes up, he needs to eat. Because if he does not eat, this is going to happen all over again. And we do not want those hypoglycemic episodes to continue. Vascular damage. All right, good job. Let's move on to another topic now, and let's talk about DKA. With DKA, the patho is what we need to cover first here. Now, the main thing that I'm thinking of here is anything that can make the glucose go up can send the client into DKA. And so the first thing that I think of is illness. Okay, that is one of the main things that makes somebody's glucose go up, illness. Now, I'm also thinking about things like infection or maybe even skipping a dose of insulin. That can make the client's glucose go up. And it can go up so fast and high that they can end up in DKA. Now, DKA may also be the very first sign of diabetes. And remember, with type 1 diabetics, we just say that the first sign is DKA because it happens so fast, right? And then the other signs and symptoms that you see will look the same as your type 1 diabetic. Okay, pretty much the same exact signs and symptoms. All right, now, just a reminder with DKA, you have very little to no insulin at all, and you're going to have severe hyperglycemia, and that can lead to a fat breakdown and metabolic acidosis. So we have to be very careful with this. All right, let's treat DKA. The main things that we do for treatment with DKA is the first thing we have to do is treat whatever their illness is. Okay, if it's the flu or whatever type of infection they have, we have to get rid of that infection or treat the illness. Now, one of the other things that you might see is that you'll have people keep coming back in, experiencing DKA from something as simple as missing that dose of insulin. Yes, one dose is enough to send someone into DKA. So we always want them to take the appropriate amount of insulin. It's going to make their glucose go up really too quickly and too high. All right, we're going to be checking hourly glucose levels and potassium levels. Okay, now why in the world do we check the potassium? Because there's something that they're going to be getting in their IV that's going to help, but it can also cause another problem. Insulin. Okay, when the client is getting IV insulin, there are two hypostates that you always have to watch for. You have to watch for hypoglycemia because insulin makes glucose go into the cell. And then you have to watch for hypokalemia because it also makes potassium go into the cell. So you could end up with the critical or even lethal value for your potassium. So you need to make sure that you call the primary healthcare provider if that happens. All right, also we need to be checking hourly outputs. Remember, the client is going to be voiding a lot. They've had that polyuria. We also need to make sure that we're checking the client's ECG or EKG because we're, again, messing with potassium. Now, the deal about the hourly outputs is that if the client has had polyuria, by the time they get to me, they could be experiencing oliguria or maybe even anuria, where they're not putting out anything at all. So I need good urinary output, good kidney perfusion the whole time. So that's one of the reasons why I got to check that output. All right, we're also going to check the client's ABG. Now, I want you to tell me what acid-base imbalance are they at risk for? What am I looking for when I'm checking their ABG? All right, remember with DKA, their problem is metabolic acidosis. Okay, metabolic acidosis is going to be their issue. So that's the one that I'm going to make sure that I'm looking for. All right, IV fluids are going to be very important for this client. Remember that polyuria? And polyuria can cause shock. So that is the main reason why I've got to make sure that I'm giving this client those IV fluids. Now what we're going to do is we're going to start off with normal saline. Normal saline is an isotonic solution. That just means that it's going to go into the vascular space and it's going to stay there. It's going to build up the volume. It's going to build up the pressure. It's not going to switch. It's not going to swap. It is exactly what I need in this situation. So IV fluids are important here. Again, that normal saline. Now, what is also going to happen is once the glucose gets down to about 250 to 300, we're going to switch one of their IVs to D5W. Now, why in the world do we do that? 250 to 300 is still very high. But I've got to switch one of those to D5W because remember I told you, you don't ever want to bring someone's glucose down too quickly because if you do, that can cause a drastic fluid shift and your client could end up with cerebral edema, and we do not want that. So we're going to bring down the glucose very slowly. Plus, remember, this client could start feeling hypoglycemic at that point because their glucose has been like 600 plus. So 250 to 300 would make them feel hypoglycemic. All right. Now, also, they're still getting insulin in their IV, and that could be bringing down that glucose even more. All right. Now, also, at one point, I think the primary healthcare provider is going to come in and add something else to this client's IV. What do you think that is? Let me know in the comments or the chat. Okay, the primary healthcare provider is going to come in and add something else to this client's IV. Okay, we already switched one of the IV fluids to D5W, and then we're going to have to add back in potassium because most likely that insulin is going to drive that potassium too low. So that we're also watching those potassium levels because we may have to add that back in too. All right, now DKA is what you're going to experience with your type 1 on the NCLEX. So what happens with the type 2? They get something called HHNK or HHS. HHNK or HHS. All right, so they abbreviate those because the words are just really too long. Hyperglycemic, hyperketosis, or hyperosmolar state. Okay, it's too much. It's too much. All right, so with these, what we're going to see is that this looks just like DKA, except there's one really big difference. No acidosis. It pretty much looks exactly the same, except there's no acidosis. The glucose is still very high, greater than 600, but again, no acidosis. Okay, so what happens here is that this client comes into the emergency department. Everybody knows that they're a diabetic, and they're like, oh, I bet you when this lab report comes back, it's going to be DKA. Well, the lab report comes back and there's no acidosis. It's not DKA. You can't be in DKA if there's no acidosis, right? So that lets me know that this is a type 2 diabetic. Okay, so how in the world does that work? How does that happen? Well, if you know anything about type 2s, you know that they make just enough insulin to keep them from breaking down their body fat. So if you don't break down your body fat, then you're not going to have any ketones. And then if you don't have any ketones, you're not going to have acidosis. So are they going to have that fruity breath odor? No, because that's ketones that you smell. Okay, what about Kussmaul's respirations? No, because that is the mechanism to help you blow off the acids that you have. They don't have that, so they're not going to see any of this, and that lets me know again that this is a type 2 diabetic. So in the NCLEX world, they're going to keep this separated for you. Your type 1 is going to experience DKA. Your type 2 is going to experience HHNK or HHS. And again, they're going to keep those completely separated for you just to make it make more sense. Now, remember, in the real world, anything can happen. All right, now DKA and HHNK are both hyperosmolar states. And these both are caused by two problems. One, hyperglycemia. And then two, dehydration. Okay, that is the main issue that we see with this. But just a reminder, the big difference is that there is no acidosis with HHNK. All right, now let's pick some other issues that we can see here. Vascular problems are definitely something that I can see with my client. This client tends to develop poor circulation everywhere because their vessels have been damaged. Now remember we said sugar accumulates inside the vessel lumen. It makes it really hard for the blood to flow, and basically it clogs up their arteries. Okay, it just makes it really hard for the blood to flow for this client. Now the more controlled the client is, the fewer complications they experience. So what we're going to talk about here is worst case scenario. Okay, so number one, diabetic retinopathy. Your eyes are very vascular. You have a good blood flow to your eyes. Okay, well, if your client has diabetes and it's uncontrolled, you're not going to get good blood flow there. And this is one of the main reasons why a lot of clients with uncontrolled diabetes experience blindness, because they do not have good blood flow to their eyes. All right, nephropathy is another problem that we see. We know that our kidneys are very vascular. Well, if you don't have good blood flow to your kidneys, then what could end up happening is that you're going to need dialysis. And so that's why a lot of times clients with uncontrolled diabetes end up needing dialysis. All right, neuropathy is another problem that we have. Guys, that is just nerve damage, and that can lead to multiple other issues. And the number one issue with that is our sexual problems, like impotence or a decreased sensation. Now, impotence might actually be the thing that sends a male client to the primary healthcare provider for the very first time. But by the time they get there, they've already got nerve damage. That means they've had diabetes for a long time. And so we want clients to get screened yearly. Okay, we need them to get that screening. Go to those primary healthcare provider appointments, because again, sugar kills your nerves. And then number two is your foot and leg problems, pain, paresthesia, numbness. The problem here is that this client could end up accidentally getting into some water that's too hot, and now we have a burn on top of having diabetes. And then if they get a burn, they might get an infection. And if they get an infection, they might need an amputation. You see how that goes? We're assuming the worst, right? Yep. All right, now let's talk about foot care for just a second. Because guys, taking care of feet is very important, especially when we have a client with diabetes. All right, so if I'm thinking about having to do foot care here, if I have to cut the toenails, which I do not want to, but if I have to, I cut them straight across. I do not want to cut them curved or too short, because if I do, they're going to grow ingrown. I'm going to dry completely in between their toes. Okay, bacteria and fungus love to live in dark, wet places. All right, another thing is that they have to wear well-fitting shoes all the time, and people don't like to do that. They find a pair of shoes that they like, they're a half size too small, and we buy them anyway and stretch them out. Clients with diabetes do not need to do that. In fact, nobody needs to do that. Another thing is inspection. They need to inspect their feet every single day, and if they can't see the bottom, they either need to use a mirror or get somebody else to do it, a friend, a really good friend. All right, and then no harsh chemicals, betadine or anything like that. We cannot use those chemicals on the feet. They cannot handle that. All right, good job. Okay, now another problem that we can see when it comes to nerve damage is something called neurogenic bladder. This is where your bladder loses its tone, or it may not empty properly, or it may empty spontaneously. Okay, so guys, if you don't have any control over your bladder and it just empties whenever it wants to, what is that called? Incontinence, right? Yeah, this client can experience incontinence. Or it doesn't empty at all. What is that called? Retention. Okay, bladder retention. We don't want either of these things. Okay, and then a fourth problem that we can see with nerve damage is gastroparesis. This is where you have a delay in the emptying of the stomach. And guys, if your stomach is delayed in emptying, then you're going to have a problem with aspiration. Okay, I am so scared that this client could aspirate. It just increases that risk. All right, and we know this one. The number one problem that clients with diabetes can experience is they have an alteration in their immune system, which automatically means that they're at a high risk for infection. Okay, infection is definitely on their list of major problems that they can experience. Okay, so let's think about this. Remember, we like to assume the worst. If one problem happens, something else can happen. So let's say they get a bladder infection. If we don't clear that bladder infection up, then what could happen is that it could travel up into my kidneys, right? Oh, and now I need dialysis. You see how that works? Yep. So they're prone to getting bladder infections. All right, what if they get a sore on their foot or a blister on their foot? That could get infected too. And if it does, could that lead to a possible amputation? Yes, absolutely. So do you see how that works? We're going to go automatically and assume the worst because this is a chronic health condition and they are always at risk. All right, nice job, guys. Okay, so now what we want to do is let's just do some questions together. Okay, so we've got a few questions that we're going to work on. Together, we're going to put one at a time on your screen and give you some time to think about it. And what I want you to do is look over the question and then let me know in the chat box or the comments what you think the answer or answers to the questions are. Okay, these are going to all be different types of formats. So you have some that are select all that apply, some that are not, some that are others. Okay, so take a peek at your very first question. Look over it, use the chat or the comments to let me know what you think, and then I'm going to come back on and I'm going to walk us through it together. All right, friends, if you need more time, you've got it. Okay, but let's start going over this one. Remember, we already talked about the rules of select all that apply, so you can use that in every select all that apply question that you get. All right, so let's see what's happening in this scenario so we can fix it. We've got a client with diabetes. They call the nurse hotline and they report some signs and symptoms. Okay, they've got shakiness, nervousness, and palpitations. And they want to know what questions could we ask that would yield more information to help us decide if this is a hypoglycemic episode. Okay, now those are automatically signs and symptoms of hypoglycemia, but let's ask some questions to make sure that it is, right? Okay, so let's look at these and figure out if these would be good questions to help us. Look at option number 1. What have you eaten today and at what times? Guys, do you remember when we said that hunger is the most classic symptom of hypoglycemia, but it's also the one that people typically just ignore? That's an excellent question because if the client says, I forgot to eat today, then we already know, right? That's a perfect question. Or if it's been too long since they've eaten, or if all they ate was a donut or 6. Yeah. We're gonna have trouble because they were gonna be on a hyperglycemic episode and then crash and burn, right? Yeah, one's great. I need to ask that one. All right, let's look at option number 2. Are you using insulin as a treatment of diabetes? And if so, what kind? Okay, guys, insulin, it doesn't matter what time you give it or what kind it is. Worry about hypoglycemic episodes because the client can have a hypoglycemic episode at any point if they are using insulin. It's about how their body absorbs it, right? And their body could absorb it too much, sending them into a hypoglycemic episode. Option number 2 is a true statement. All right, look at 3. Do you feel hungry? People would brush that off. But remember we said hunger is a classic symptom of hypoglycemia. Option number 3 is true. This is an excellent question to ask. All right, look at 4. Do you have access to a glucose monitor to check your current glucose level? That sounds right too, because remember we said that they need to check their glucose frequently, so that way they know what their numbers are. I need you to go check it. That'll give me great information as to if this is hypoglycemic episode or not. Option number 4 is true. And then let's look at option number 5. Does your skin feel hot and dry? Okay, well, if you're hypoglycemic, how would the skin feel? Cold and clammy. You already know that one. So hot and dry doesn't have anything to do with this. So option number 5 is false. Okay, that one is not the question that we need to ask. So out of these, all of these are true except option number 5. Good job. All right, let's do another one. Look at question number 2, and I'm going to tell you right now it's another select all that apply question, and do the same thing. Take your time, look over it, come up with your answers. Let me know in the comments or the chat what you think, and then I'm going to come back on and we're going to walk through it together. All right, if you need more time, you've got it, but let me just point out a few things here. First, it is select all that apply. You know the rules. But then the other thing is that you've got your exhibit there with your normal reference ranges. Now guys, just a reminder, they will give you the normal reference ranges for labs as long as there is a value listed either in the stem of the question or in the answer choices. If they just say low or high, don't expect to get the normal ranges for that. But if it's a number, they will give you those ranges. All right, so let's look and see what's going on here. A client with long-standing history of diabetes presents to the emergency department and they've got a 400 glucose. Okay, that's high. All right, and then they want to know what lab data from the client is consistent with DKA. Okay, guys. The way they formatted this made it seem more difficult than it actually is. All they're asking you is what matches DKA? That's it. Does this match DKA? That's the only question that you have to ask yourself. True or false? Okay, let's look at option number 1. A sodium serum of 140. Okay, well, that kind of sometimes throws you off, right? Because you're like, why are they asking about sodium when this is glucose? Okay, well, that should kind of give you a good clue there, but they did give you the normal sodium level. It's 135 to 145. Okay, but what I want you to think about here is that a client who has experienced DKA is going to have lots of polyuria. They're going to be putting out large amounts of dilute urine, and that's going to leave them dehydrated. Their vascular space is going to be dehydrated, meaning they don't have enough water in their vascular space, but they have a lot of sodium left over. Okay? And what could happen is that sodium level would be up. It would not be normal. Okay, it would not be normal. So option number 1, I would not expect to see a normal sodium level because my client would be dehydrated. Too much water, not enough water and too much sodium. Option number 1 is false. See, you have to know your content in order to answer this question. Now, if you were just thinking, what does sodium have to do with it, false, you would have gotten it right, but you could miss that in another future question if they were trying to be more specific. All right, look at option number 2, ketonuria. All that means is that you have ketones in your urine. Okay, guys, do you see ketones with DKA? Yes, option number 2 is true. I will see ketones spilling over into the urine because that is from them breaking down their fat, and the fat transformed into ketones. All right, moving on to option number 3, serum potassium of 5.3. Okay, well, let's just first look at the normal ranges. 3.5 to 5 is what's normal. So let's think about what happens with the potassium when the client is experiencing DKA. And so what happens here is that we're trying to drive the glucose and the potassium out of their vascular space and into the cell where it needs to go. When somebody is hyperglycemic or experiencing diabetic ketoacidosis, both of those things, glucose and potassium, are hanging out in the vascular space, in the blood. So that means that the glucose and the potassium will be elevated until I do something to treat it. So is this elevated? Yes, it is. It is out of the normal range. So option number 3 is a true statement. I need to pick it. All right, look at option number 4. Moving on. The PaCO2 on the ABG is 52. This is your CO2 component. Okay, so first let's look at the normal. They gave us that. CO2 should be 35 to 45. That is normal. Okay, so 35 is on the low end of the CO2 and 45 is on the high end of the CO2. CO2 is an acid. Okay, so if the client is in DKA, they will be in acidosis, right? They will be in acidosis. Okay, so when I look at this, this is false. Okay, so what you have to think about is the CO2 is the respiratory component, not the metabolic component, right? Okay, so yeah, this can get a little confusing if you didn't think about it because you're like, oh, but 52 is high. Yeah, what that means is that they're not blowing off their acids. When somebody is in DKA, they come in with Kussmaul's respirations, don't they? Yes, that is the mechanism where their body just automatically starts trying to fix this. We're not even treating it yet. Their body has jumped in to try to fix it and say, breathe, 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 breathe off those acids. And so what would happen is they would be breathing off their CO2, making their CO2 level drop. This one is still too high, meaning they're holding it in. That can't be DKA. So option number 4 is false. All right, let's look at our last one here. The pH. Okay, guys, pH either tells us if we're, neutral or if we are in acidosis or alkalosis. So DKA is acidosis, and acidosis is on the low end of the scale. So first, let's just look at the normal. The pH norm is 7.35 to 7.45. Anything less than 7.35 is acidosis. Anything more than 7.45 is alkalosis. So 7.3 is low. It is less than 7.35. That is acidosis. And my client should be in acidosis. This is a clue that we've got a problem. Option number 5 is true. Okay, guys, do y'all see how that works? You have got to know your content in order to answer these questions appropriately. So for question number 2, 2, 3, and 5 are all the true statements here. All right. Okay, let's move on. Let's look at question number 3. And oh my goodness, another select all that apply. Do the same thing. Look over this one and let me know in the chat or the comments what you think the answer or answers to this will be. All right, friends, another select all that apply, another chance for us to use those rules that we already know, so just apply that. Okay, so what's going on here is they want to know what interventions will you, the nurse, initiate for a patient who is in metabolic acidosis due to DKA. All this is asking is, my client is in DKA, what do I do about it? And remember, when you do actions or options, you want those things to fix the problem that your client is experiencing. It has to directly tackle and address the DKA that they are experiencing. All right, so let's look at each of these options and figure out if that's going to be helpful. Option number 1, encourage the client to turn, cough, and deep breathe. Now, some of you love this answer because you're like, oh, we always do that. That's just a perfect intervention for everything. No, it's not. In fact, this would be harmful. Why? Because your client is trying to Kussmaul and you're trying to interrupt that. You're going, Don't do that. Don't have those deep and rapid respirations. I want you to turn, I want you to cough, and I want you to take a deep breath in. Versus having deep and rapid respirations, I'm trying to slow you down and do some breathing exercises right now. This is not helpful. That is for the post-op client, not for the client in DKA. This would actually be harmful because you would try to disrupt the natural process of Kussmaul's respirations. Option number 1, false. All right, again, you got to know your content. If you don't, you're not going to get these right. Okay, move on to option number 2. Initiate fluid replacement. Absolutely, because remember in DKA, they've had polyuria and they're dehydrated. We've got to get them some more fluids on board. So option number 2 is a true statement. All right, move on to option number 3. Monitor potassium level hourly. That sounds like a very good idea because remember, we said that their potassium is already going to be elevated because their glucose is too high and their potassium is high. When I start giving them the treatment, which is insulin, it's going to drive that potassium back into the cell, but it could lower it too much, and I better watch that. I don't want them to have a lethal arrhythmia, which you already know potassium is known to do, so we've got to watch that. Option number 3 is true. All right, move on to option number 4. Provide chest percussion with postural drainage. Yes, let's treat your pneumonia or atelectasis. No, okay, that would again disrupt the natural process of those Kussmaul respirations. I'm not going to do anything with you right now. I'm going to let you Kussmaul. Okay, keep going. Keep Kussmauling because it's helping. Option number 4 is not for this. This is not the correct action for the problem that we have. It's false. All right, look at option number 5. Absolutely. I'm going to check your glucose level hourly because remember, we don't want to bring it down too quickly. We want it to come down, but we don't want it to come down too fast. Option number 5 is true. And then option number 6, yes, they need insulin to help with the glucose and the potassium. So option number 6 is also a true statement as well. So what do we do for DKA? 2, 3, 5, 6. Very good. All right, guys, let's do another question. Look at question number 4. Let me know, and I know we're going to help you out. No more select all that apply for this one. Okay, look at question number 4. Look over it and let me know in the chat what you think the correct answer to this one is. All right, let's look at this one. If you need more time, you've got it. Okay, but there's no, select all that apply here, so let's just figure out what's going on, and then we'll do the process of narrowing down. You are caring for a newly diagnosed diabetic and diabetic, hyperosmolar, hyperglycemic, non-ketotic state. Do y'all see why they just now abbreviate that? That's just too much. HHNK is what they are experiencing. What do you anticipate to be in the immediate treatment plan? Okay, so what do you anticipate to be in their immediate treatment plan for this problem? Okay, so let's narrow this down. What are automatically just answers that are out? Okay, so first when I'm looking at this, I know I'm going to get rid of option number 1. Because does a type 2 need insulin initially? No. Okay, I'm not going to go with an insulin initially, but at some point, they're going to need some insulin. Okay, but then if they need insulin, would it be NPH, intermediate acting? No. They're either going to get rapid or regular. They're not going to get intermediate acting. That's the wrong one. Okay, that one's out. All right, let's look at another one. Oh my goodness, I'm for sure getting rid of 2. Potassium. Slow IV push. Do you give potassium IV push at all? No, that's like one of the biggest safety things that we learned in nursing school, right? There are very few times where something is never or always. We stay away from words like that, right? But potassium is one where we never give it IV push. There is no situation in life where you will ever give it IV push. And guys, they try to throw you off by saying, slow. You'll just kill them slowly instead of killing them immediately if you do that. Okay, we do not want to do option number 2. Option number 2 is very unsafe, and we don't want to be an unsafe nurse. That one's out too. So this narrows this down between either doing option number 3 or option number 4. Okay, IV bicarb. IV bicarb is a base, and the only reason why I would ever give somebody a base is to counteract acids. Does the client in HHNK have acidosis? No, remember we said that's the number one thing that is different. There is no acidosis. So I don't need to give bicarb because there's no acidosis to counteract. That means the only thing that's going to work here is 3. IV administration of isotonic saline. Guys, all that is your isotonic solution. Okay, that is your normal saline. That's all that is. That means it's going to go into the vascular space. It's going to build up the volume and the pressure. It's not going to switch. It's not going to swap. It's going to rehydrate the client, which is what I need. Option number 3 is the only answer that works here. Okay, do y'all see how that works? Again, in order to answer this question too, I have to know my content. You're trying to get away from knowing content and it's not going to work. You have to know your content, or otherwise, all you're doing is guessing and using strategy to help you guess. And you're going to get a lot of questions wrong doing that. You're going to get some right, but you're going to get a lot of questions wrong doing that. Versus if I know my content and I use strategy on top of knowing my content, I'm going to get a lot of questions right. I'm still going to miss some, but I'm going to get a lot of them right, which is the name of the game on NCLEX. All right, let's talk about your options, because at Hurst Review, we have an option for everyone. And you're going to choose the option that works best for you based on your learning style. Now, my suggestion always is that we have a little journey that you can take on our website where you answer a few questions. And based on the way that you answer those questions, we will tell you the review that's going to work best for you, the type of review. Okay, so let's talk about the differences between some of these. Let's talk about Hurst Now versus InStream. Hurst Now is fully online. It is completely self-paced. It is perfect for the student that needs to have flexibility in their learning plan. And with this one, you can choose 30, 60, 90, or even 120 days access. With InStream, InStream is virtual live, sort of like what we're doing right now. I am live in the studio right now. You are at home, logged in at a certain time right now. You can interact with me. You can ask questions in the chat. You can interact in the chat. That's exactly how InStream works. It is 3 days of live lecture where you show up at a certain time. This is really good for the student that needs a little bit more structure in their learning plan, or they really want to feel like they're still in a classroom style environment versus doing everything fully online. All right. So for this one, 3 days, but you still get your online access, and your online account access is either 6 months or 9 months, depending on if you are a PN, VN, or an RN test taker. All right, let's talk about Elevate. Elevate can be added to any option of the Hurst Review, but it does automatically come with Hurst Now Plus. It is the study companion to the Hurst Review product. This is going to give you more scenarios, more questions, and we're also going to walk you through the study process so that way you don't have to do that on your own. When students take Elevate with their review, it boosts their confidence, but it also helps them know that they studied all the right things in the right way. All right, and again, it comes with Hurst Now Plus, but you can add it to any option of the review. And just as an added bonus, it was not made for exit exams. It was specifically made for the NCLEX, but it helps with your exit exams. We have data that shows that a lot of students have seen an increase in their exit exam score by up to almost 64 points. Okay, 63.83 point increase in standardized exit exam scores, which is huge. Okay, that is more than just the line between not passing that exit exam and passing it with flying colors. All right, now we also know everybody loves a payment plan option. I know I do because things are expensive. And so we know that you love a payment plan option too, especially for something like NCLEX Prep. So you've got PayPal, Google Pay, and Apple Pay is live. So you can go ahead and use any of those servicers. And guys, some of these like PayPal give you multiple options on how you can make your payments. Some of them spreading out your payments into either 6-month or 12-month terms. All right, guys, we have lots of free events. What you're in right now is considered to be one. So make sure that you join us for any free events that you would like to. You can either go to this website or you can scan this QR code and bookmark the website that comes up. This is where you're going to register for all of our free events that we have. And so you can make sure that you go ahead and do that if you want to, or you can bookmark that and come back to it later. All of June's events are already live in the on the system, but July's events will be coming soon, so that way you know that you can register for those. All right, let's get you the discount code for the first time today. Please make sure that you take a picture, screenshot, write down, whatever you need to do, because Free 2025 is your discount code for the entire year. Now, guys, we do not give this code out anywhere else. The only other time that we give this code out is when we're doing our lives on social media. That's it. We do not give these via the DM. We do not save these anywhere. You please make sure that you write this down now because you will not see it on our website. This code will get you up to $40 off the review of your choice. So please make sure that you utilize that. Do not pay retail because you don't have to. All right, and we love giving away QBanks when we can, and we have got an eligible winner. IT has randomly selected our winner for this session, and the winner is Christine Domingo. Congratulations to you, Christine Domingo. Now, Christine, you do not have to do anything at all. We've got your contact information. We will send you an email. Please give us up to 48 hours, though, to get this email to you, 2 business days, okay? Because it takes us a little while to generate the code, double check it, and then get it out. So please give us at least 2 business days to get you this code. Check your spam inbox because sometimes it goes into the wrong spot, and we will make sure that you get this. If you do not receive that code within 2 business days, then you are free to definitely reach back out to us. We will make sure that you get that, but you should see it in your inbox or your spam inbox within 2 business days. So again, congratulations to you, Christine. That is an over 1,500 question practice QBank, 30 days access to it, $109 value that you just won. All right, guys, that is all that we have in this session, but I'm coming back at noon. We've got an NCLEX challenge that we're going to do at noon. We're going to answer 3 NCLEX questions together. We're going to go very deeply into those questions. So if you want to practice some more, come back at 12 o'clock p.m. Central Standard Time. Same link, same place, and we will do those questions together. Guys, I hope you have a great rest of your day. Stay safe. Continue to save lives. Share these events with other people and follow us on social media at Hurst Review or at Hurst Review or at Hurst Review Services on all of our platforms. Guys, thank you so much again for joining us, and we hope to see you later. Bye-bye.